Good morning. I want to thank all of you for being here today and for the work you've been doing to help us spread the information that's needed to this community about the COVID-19 pandemic. It is something that has been unprecedented, as been said before, in the history of this country. It is something that we're still trying to grapple with and get our arms around as a city and as a community, as a state, and as a nation. I wanted to come before you today because I think it's very important that you get an update and that the members of the River region in Central Alabama understand where things are right now as it relates to our community. There's been a lot of information about the state relaxing some of its orders, and we understand that. There's been a lot of information about the country relaxing some of its restrictions, and we certainly understand that. However, in Montgomery in particular, we have ended up on a internal White House list of places to watch, places that could be a hotspot. And as we have increased our testing capacity, we have also found our positive test numbers continuing to rise. And I come to discuss this because it's important that you understand whether you believe this or not, it is a serious issue. It is a matter that can not only impact you, but more importantly, it can impact others. And we're at a very critical point in our healthcare system's capacity to manage this crisis. They're at a capacity that is not sustainable, and that puts everyone, our neighbors, our family, our friends, our church members, our colleagues and coworkers in harm's way. I believe it's imperative that we understand that right now, Montgomery County, Central Alabama, is producing one of the largest outputs of positive test cases in this state. We have to be honest with ourselves and understand that although we are ready to get back to work, we're ready to get back to enjoying our friends and our family and getting back to doing the things that we were doing prior to March of this year, we're not there yet. I certainly understand those who are ready to get things back on track and who are ready to expand their businesses and get back to the plans they had for this year. And we want to help them do that. But we have to take all the precautionary measures that we can. And I feel it's incumbent upon me as the mayor of this city, and I think it's incumbent upon this city as the regional capital for Central Alabama, and certainly as a state government capital, that we be very transparent and very honest about where we are right now. And we have a situation where we have 950 confirmed cases as of this morning in Montgomery County. We have had 25 COVID-19 related deaths in Montgomery County. Between May 1st and May the 7th, 2020, we had a 45% increase in COVID-19 cases. Between May 7th and May 14th, we had a 46% increases in COVID-19 cases. And between May 14th and May 19th, we've had a 20% increase in COVID-19 cases. These numbers are not where we'd like them to be. We certainly understand that as we test more people, we're going to see some different numbers. However, the trajectory that we have right now is one that's been up, kind of lateral, down, and then back up. But what we have not seen is a sustained downward trend. That is problematic. And when we think about the issues that we face, in particular in this part of Alabama, with our vulnerable communities, with those who suffer from pre-existing health conditions, it is important for us to take steps that are not only important to our own well-being, but those of our friends and our neighbors. And so what I want to express to not only the city of Montgomery, but to the river region and all of central Alabama and to this state, is that be careful. I understand COVID-19 fatigue. People are ready to get back to sports. They're ready to get back to recreation. They're ready to get back to doing things they are used to doing. I certainly respect that and I understand that. I've been a small business owner. I understand what many small business owners are dealing with right now and wanting to get back to seeing their payroll exist in a way that is functional for them and is functional for their employees. I understand that. But we have to make sure we are alert and we are aware to the risks that we also have. I also realize that churches are no longer restricted. But I want to ask all of our faith leaders to exhibit a little bit more responsibility and to continue to work with us going forward. We've got a number of cases in the state and across this country that have been linked to church gatherings that are happening prematurely. It's important that we understand that because the methods change does not mean that the message has to. So we want to continue with those methods that have worked, whether that be online or whether that be through drive-up services, things along those lines that allow people to still get the message of their faith and connect spiritually, but remain apart physically. It's very important that we continue to practice social distancing, that we continue to practice those sanitary routines that we all were doing, I think, just a few weeks ago. But I'm not sure how many people are still wiping down their phones or how many people are still wearing a mask as much as they should. And we want people to do those things. Everything that you can do will help. There is no silver bullet. There is no panacea. There is no vaccine. So we have to take these steps that are necessary in order to slow the spread of this virus and make sure we aren't putting people in danger that shouldn't be. Whether those people be our senior citizens or whether those people be people who are dealing with other illnesses. Now, I want to make sure that I inform you of the last major issue before I ask our EMA director, Christina Thornton, to come up and give you some information as well. And that is where we are in our healthcare system. As I mentioned before, our healthcare system is at a critical point right now. And we're at a point that we are now diverting acute care patients to Birmingham because of our ICU bed shortage. That's very serious. Many people in Montgomery's hospitals are not from Montgomery. They're suffering because they don't have the rural healthcare system in place that they need. And so they come to Montgomery in order to get the type of medication and the type of treatment that they cannot get in their own communities. Well, right now, if you're from Montgomery and you need an ICU bed, you're in trouble. If you're from central Alabama and you need an ICU bed, you may not be able to get one because our healthcare system has been maxed out. And so these patients are being diverted to Birmingham. And we don't want to lose anyone, any life, because we don't have the resources to treat them in this community. And right now we are short at Baptist East by 3 beds. Baptist South has 0 ICU beds. Baptist Health in Prattville has 0 ICU beds. And Jackson Hospital, not far from here in Montgomery, has 1. I want us to really think about the seriousness of that because none of us know who may need that ICU bed today and who may need that this evening, tomorrow, or over this extended Memorial Day weekend. we want to make sure that we are doing everything we can to keep not only our healthcare system operable and working at a peak level, but that we are not taking needless risks as it relates to our socializing because we can't be disciplined enough for a few more days or a few more weeks to practice some of the behaviors that have gotten us the progress that we've made thus far. And so I don't come before you every day to talk about how dreary the circumstances are, but I come before you this day to tell you that the circumstances are certainly dire. And I think that we have to make sure that we don't get into a hole that we cannot get ourselves out of in this city, in this community, and in this region, and that we continue to do those things both as business owners, as government officials, and as private citizens, to certainly respect the choices of each and every person that lives and works here, but also respect the needs and the health of our fellow man. It is important that we continue to do that by wearing masks in public, by sharing masks if you have access to them with your family, with your friends, and by staying at home still as often as you can. This is a situation that we are all ready to get past, but we can't get past this situation until we have done the necessary things that we can do and we can control ourselves. And right now, with the numbers in Montgomery continuing to rise, with our shortage of ICU beds in this community, there's a domino effect on each step that we take, on each action that we take, and we don't know where that's going to end up for someone else who may need it. And so I want to conclude this part just by thanking all of our first responders. I want to thank all of our EMT and medical professionals for the great work that they've done. I'd like to thank all of the community volunteers who've gone over and beyond to keep us afloat throughout these last few months. I want to thank each and every person who has worked, who has done something for someone else that they didn't have to do throughout this pandemic. All of these things have helped this community. All of these things have helped the mindset and have helped the spirit, as well as the body of people that call Montgomery, the River Region, and Central Alabama home. And we thank you for that. There's not enough thanks to go around for those small acts of kindness and those small gestures that we don't know about and that you haven't told someone about, but that you've just done out of the kindness and out of the goodness of your heart. That's what makes this community so special. That's what makes us who we are here in Alabama. But we want to make sure that we respect each and every person that we are thanking in the hospitals, police and fire, sanitation, in our retail stores, in our restaurants and small businesses, those people who never stop by doing those things that we can to continue to slow the spread of coronavirus. And while I know people are ready to enjoy this Memorial Day weekend and are fatigued by all of this, I just want to reiterate, we are not there yet. We are still in a place where we can go either way, and we don't want to slip and fall off the cliff. So I hope that these messages that we have been sharing with you over the last few days, from our city council meeting to this press conference today, will reinforce where we are and what we have to continue to do, even as we start slowly to reopen the economy and restrictions are eased. I ask that we place some of our own restrictions on ourselves and practice sound behavior, sound actions throughout this pandemic. So with that said, I'll ask our EMA Director, Christina Thornton, to come and give some comments and some additional information. And then if you have any questions that you would like to ask me at that time, I'll be more than willing to take them. Thank you.
Good morning. One thing that I want to be sure that everyone is aware of is the amazing efforts of the Alabama Emergency Management Agency and Alabama Department of Public Health in providing protective personal equipment for a lot of our officers, nurses, nursing homes. Everyone working together has refilled those shortages that were initially reported. We have an abundance of those masks, so we're able to make sure and provide that to our public safety partners, sanitation, street maintenance, and everybody to keep our city going as much as possible. When we look at these numbers, it starts stirring that fear, and we know it's always going to go up. As more are confirmed, they're going to go up whether we like it or not. But when you start looking at 1,350 or 1,492, what it is today, out of the totality of people that have been confirmed, that's just over 11% that have been hospitalized. So although this is a tremendous strain on our hospitals, look how many did not require that kind of care. So just be mindful of that. If you don't need to go to the hospital, don't. Don't tie up those necessary beds that could be utilized. Our hospitals made efforts to change regular hospital floors to COVID preparation floors. We're looking right now at everything we're seeing because we're getting the reports of how many ventilators are available. And right now, we're okay. We are seeing that those are patients. Some of the patients that can't go home in quarantine are being kept in the hospital while they're awaiting their test results. So some of those beds are tied up for those type of situations. And although we do need to absolutely be concerned about what we're doing and sharing this information with our friends, our family, try to keep your life as normal as possible. Call your friends. You might not can go visit them, but call them. Do a FaceTime with those long distance family members, things like that. Anything you can do to try to keep your family in some sort of normal. Try to reach out, try to be kind, and try to be understanding. Be understanding with those clerks at those grocery stores that have been working long hours restocking shelves. And when you come up and there's no Lysol canisters, understand that they can't help what is delivered and they're just trying to get it out as fast as possible. Thank you to our grocery store clerks that are doing so much every day, working those long hours on their feet while we're trying to run and complain because we couldn't get any more toilet paper. Just be mindful of those type of things. Reach out to your emergency management agencies of your local counties. They are helping and trying to coordinate mass donations. So if corporations want to donate masks, we try to get them to the people as best we can, whether it be a mayor's mask giveaway like you did a couple weeks ago, or getting it to our public safety, first responders, and sanitation. Just try to keep your head up. Try to be mindful of others. Do be very well over your Memorial Day weekend. This isn't the time to have big block parties. This isn't the time to get 50 or 75 people crammed in an apartment because you can't go to a club. That's where these numbers would triple. That's where these numbers would get very, very badly in a very quick amount of time. So just be very mindful of that. And thank you.
Right now, I'll take any questions. Do you have any? Sir Brian?
Mayor, just to confirm, initially, there are 950 confirmed cases in Montgomery County today, is that right?
That's correct.
Or 25 or 29 deaths?
25.
So far, since it started?
For Montgomery County, yes, since it started, correct.
Mayor, are you concerned that you're going to have to put more restrictions on closing city offices and things like that?
I am. I'm concerned that there's a rush to get back to where we were, and that people are seeing stories of recovery, which are fantastic, and people are seeing stories of things going well in other places and not really factoring in how that may impact us here. And what I have to be concerned about are the citizens and the residents of the city of Montgomery, but also those that come and work in Montgomery or do any type of business here, even socializing or church or whatever it may be. So it's not just those folks that are here, but anyone who's coming into contact with our residents here. And so we don't want to be in a situation where we have to lock down the city, and that's why we're trying to take our message maybe to a louder level so that people understand exactly where we are and exactly what's at stake.
Mayor, if you had to summarize it in just a couple of sentences, What is the problem in terms of the city, the county not getting ahead of this? Other parts of the country, the numbers are going down, but apparently not the case here in Montgomery County. If you had to whittle it down for one sentence, what is the issue?
Well, I think that we've done a great job of staying ahead of it. I just think it's our time in the rotation. I think, Birmingham has had theirs, Tuscaloosa's had theirs, Mobile. I just think it's our time. And I think that probably comes about because people have started to move around a little bit more. People have started to relax some of their new formed habits a little bit, and I think that's why we're seeing it. So we can't trace it back to any one event or any one particular place. I just think it's just a matter of people moving around and not really following through on some of those practices. And I think certainly that there's some element to the fact that we are testing more, which I'm very pleased with. I would like to see us test as many as we can so we can understand what we can do going forward. Has something to do with some of the numbers, but I'm also looking at, again, just some of the behavior that we want to try to curb, and we want to try to make sure that people don't assume that it's over here, maybe because things are opening back up.
Mayor, can you tell me what kind of sense you've gotten from our healthcare providers, how well they're able to manage the return to elective procedures, considering everything that's happened?
The doctors have been blowing me up. That's who I probably heard from the most over the last 5 to 7 days, no question, has been from the medical professionals. And so they have not been talking about elective procedures as much as they've been talking about what's happening in the hospitals. And they have been yelling for us to be more vocal and visible in letting the public know what they're seeing in our hospital system in this region. And they are very concerned about the levels of people that are coming in. One of the things that was mentioned to me by a hospital executive is that people are coming in much more sick than they were a few weeks ago. So I think people are trying to hold off coming in, but in doing so, they're coming in worse condition. And that is a problem, and that's what I've been hearing from across this region. I don't know how everybody got my cell phone number either, but they've had them. Yes, sir.
Mayor, so when somebody does test positive, is there a procedure in place to notify people around them that they have tested positive or who may have come in contact with them?
Yes, there is a procedure that's in place, and we have that even at the city as well. We've had a couple of employees who have tested positive, and we've been quarantined. We've alerted their coworkers as well as obviously their family members as well, and encourage them to get tested.
And that's in place for the general public as well, too?
Or? Well, the general public, I think, each organization may have a different approach to that. And Christine, if you have something that, to add to it, I'm open. But my understanding is that each organization handles that differently.
Is the curfew still in effect?
The curfew is still in effect as well as a state of emergency.
Do you have any plans with your police department? She had mentioned Memorial Day weekend to be a little bit more vigilant or strongly discourage people from having block parties. I mean, is there anything legally you can do to stop that?
Well, what we want to do is if they have block parties after 10 o'clock, then they're violating the curfew any time from 10 to 5. But our police will do their job as they've been doing it in a professional manner. They're going to go out and serve and protect. And one of the things that we want to encourage people to do is not to gather in big groups. We aren't looking to arrest people. We aren't looking to bring anybody to jail or anything of that nature. But we just want to let people know what some of the health challenges are. And even though they may not be in violation of anything, just try to inform them of the risk they are taking, the risk they're putting their families and their friends in by exhibiting such behavior. So they'll just be out there in a way to work with the community to inform everyone of what's at stake and where we're trying not to be. And that's in a place where we're panicking and we are having to really lock everything down and kind of shut the faucet off, so to speak.
switching gears a little bit, if I may,
Sure.
how will the city use the CARES Act money to help you, I guess, get over the hump?
We haven't decided yet. You know, we're still, we don't know what our allocation is going to be. So that CARES Act money will come through the counties as it stands right now, and the county will then distribute that. And then we'll look at certainly those costs that are reimbursable, and then some of those areas that we've had to kind of cut back because of our lack of revenue from a city perspective. And we're still working through that process to try to prioritize what those projects are and then how to implement some of those funds. But ultimately, that's going to depend on how much we get and when we get them.
Mayor, what is your message to these doctors that are calling you? I mean, what are you telling them?
Oh, well, thanks for the work. I mean, thanks for letting us know. I mean, I would have no way of actually knowing what's transpiring in the hospitals without them. And again, as Director Thornton just mentioned, we can't thank our medical professionals enough for what they've done over these last few months. So I'm grateful for their service. Many of them have been going, far beyond the call of duty in what they're doing. So by them bringing it to our attention and by sharing this information has given us more transparency into really where we are as it relates to the critical need of the ICU beds and what that means to them from a hospital administrative standpoint. But I think the biggest takeaway for me is the fact that we're having now to divert people to Birmingham. We have not been at that point at any part of this process. That is what we were trying to avoid back in March. That's what we're continuing to try to avoid right now, is having to send patients to a place 90 miles north of here that is going to take more time and that obviously puts them and their families in an inconvenient situation because we don't have the necessary beds and we don't have the necessary resources to care for them right now.
Just in the last 3 weeks, if you know, how many people have been transported to Birmingham?
I don't have that information. Yeah.
Okay, you and I talked about this about 3 weeks ago at a separate news conference. What is the latest on your sales tax revenues? Is it as bad as you thought it would be so far?
That's a good question. It's not looking quite as bad, but it's a matter of, bad and worse. So it's not good, it's not average. I mean, we're still in a hole. We're just not as deep, and I think that we'll know a little bit more about that probably the first couple of weeks of June when we can assess where April is. We assessed where May was. May we did okay in terms of some components of our sales tax. Our sales and use tax was not as bad as we thought and projected, but we had other areas in retail that really suffered tremendously.
Any numbers you want to share with us?
I don't have the numbers handy with me, so I have those and shared them last night with the city council, but I can certainly get those to you.
Has it gotten to the point that you could be looking at layoffs at this point?
Everything is on the table right now. So, we're still looking at potentially a 20% budget deficit. So that's our last option for me. We'll look at everything before we lay anyone off in this situation. But much like businesses are having to do and people are having to do in their own homes, everybody has to tighten their pocketbook and everybody has to really look at what they have coming in versus what they have going out. But we're going to make all those decisions over these next few weeks as we deal with the budget and we look at how we'll finish up this fiscal year and how we'll start our budget cycle for 2021.
Anything new on the zoo?
On the zoo?
The Montgomery Zoo?
No, again, we're all ready to get back out there. We all are ready to get back out to the baseball fields and the parks and the restaurants, and we want to do all of those things. But we're being guided by the data, and I'm just not comfortable right now asking people to congregate there, and that's not to say that our directors and our folks at the zoo have not done their part. They have put together a fantastic plan. It's just right now our numbers are not where I want to be for us to open up a space like that. But as soon as we can kind of get our arms wrapped around it, then we're going to open up the zoo and we'll practice social distance guidelines. Everything that you see from a city perspective will be done differently, and it'll be done within the context of the new CDC recommended guidelines and best practices to make sure that we can keep people safe and people feel confident in coming out and being around and engaged in any community event that we do.
This was kind of a gloom and doom news conference today. Do you offer any light or hope? Are there any numbers that maybe 1 month from now, if not sooner, perhaps we can turn the corner? Is there anything you see that maybe we'll be out of this a lot quicker than you hope?
Well, I think if we do our part and if we remain disciplined, then certainly, you know, the city relies on tax revenue, almost disproportionately relies on sales tax revenue. So we're in a precarious place because of how overly reliant we are on sales taxes, which is a regressive form of taxing and funding your government. We were already underfunded government for our size. So no one wants to see people getting back to doing the things they were doing prior to March of this year better than I do. I mean, no one wants to see that. But we're not going to do that at the expense of overwhelming our healthcare system and some of the other indirect effects of us getting back out there. So what I hope is that going into this holiday weekend, extended weekend, great weather, normally the start of summer for many people, is that people will understand where we are here in Montgomery, where we are in Central Alabama. They'll listen to some of the advice that Director Thornton just gave in terms of not getting together in large groups and things along those lines. And hopefully that will put us in a position, Brian, where a few weeks from now we do see some positive light, if you will, and we are seeing some room for us to kind of loosen the faucet and open things back up even more so, whether that's City Hall, whether that's some of our offices and community centers, or even the zoo and other things like that. Certainly under the new protocols, we'd love to be there in a few weeks, and we're going to kind of let the data and the practices of our citizens really kind of guide us to that. And we're going to be responding to that, and that will ultimately dictate what our final decisions are.